What's really interesting here is this is a real room. We sold 50 of these rooms in Minneapolis that look much like this. It's this configuration. This is not an acute care room, as you can see. In fact, the application was an orthopedic hospital where the recovery time is 3 to 30 days. The hospital had structured itself in a way where they had 50 rooms that were less than acute for those longer term recovery periods. But this was the end result. Many people have remarked on the beauty of the laminates, the solid surface that have come together in this setting. Let's look at a couple of our sleepers. We're up to 5 different sleep solutions now. A couple of years ago, we introduced the Emilio, which is just a beautiful product in that its footprint doesn't change when you move to a sleep position. And that's critically important, particularly in acute care, where most sleepers change the footprint. They pull out, they become larger, they become different when they're in a sleep position. So think of that emergency situation in the middle of the night where the nurse comes into the room and wastes precious seconds thinking about what's on the floor and where movement can occur. Here, there's no worry of that because the footprint hasn't changed. A couple of other interesting characteristics of the Emilio are the back. It was a low back because typically this will be against the window. As we all know, patient rooms are generally designed with the caregiver portion of the room normally closest to the door, the patient portion of the room, and the family portion of the room. The family portion tends to be at the back of the room against the window in an alcove. So the architect may have left 90 inches for that alcove. Well, there's a window against it, so we made sure it was a low back. We sell this product by the inch. So if there's 90 inches of clear space and they want an inch of a gap between the furniture and the wall, they need 88 inches. Come to Krug. We'll do it in 88 or 87 or 86, whatever you need. We build it to the exact size required. While we're on the topic of sleepers, let's go to our 5th solution in sleepers. This is a bench sleeper. Very small, very compact. You can see minimal depth, taking up very little floor space. Obviously works well as a bench, but it easily converts into a sleeper. As you go towards that sleep position, please note that we have storage below. So the storage is built in, and turning it into a sleeper takes no time at all, gives you the amount of space you need for a sleep surface, and it came from a very, very small unit. This is 78 inches long, which certainly accommodates a fairly large person. So very small space, yet does what it needs to do. I'd like to show you this recliner, and there are 2 aspects I'd like to point out. A couple of years ago, we introduced infusion recliners, and we brought to the infusion recliner characteristics that weren't in our standard recliners. When we go to a furniture fair and we're lined up against 4 or 5 competitive recliners, every recliner sits about the same way. And generally, they have high-density foam, and it's a fairly hard sit, but everybody's the same. The reason for that hard sit is if the foam is too soft, it breaks down over time, and the hospital wants a product that's going to be solid for some period. So we all use a high-density foam. As we developed the infusion recliner, the requirements were a little different. We said, let's make it feel a little bit more as if you're sitting in your family room at home. In infusion, you could be sitting in that chair for 6 hours. That's a long time to sit on what could be a slightly uncomfortable recliner. So what we did is we changed the foam. We didn't change the underlying foam. We added a topper foam that is lower density, so it's a softer foam. And we built it up at the sides, and we built it up at the top. So now we've got a level of comfort that's a little closer to sitting in your family room at home. Another aspect of the infusion recliner was our traditional recliners had a solid grip, as you see here. And that's important, getting in and out of a recliner. So the Jordan recliner, it's really easy to grip the arms and come out of the chair. But in the infusion, we said again, a person's going to be sitting here for up to 6 hours. Let's give them a soft, more comfortable arm. So we developed that. And many people said, wow, what a great arm. So what we've done is we've reintroduced our entire recliner series with this now being our standard upholstery treatment. So we've got a much softer recliner, and when you next go to that furniture fair and line up against others, I think there's going to be no question this is going to be the most comfortable. In terms of arms, rather than dictating an arm, we offer the wooden Jordan arm. We offer this same profile in solid urethane, or wood with a urethane cap, or upholstered and coming to an upholstered top, or that wider, softer arm that I mentioned. There are many other options and features, but we're allowing you to build exactly what's appropriate for your patient population. I said there are two things I wanted to talk about with this product. That was one of them. The other, we've incorporated into this unit something that we've come to the show for feedback on. What it is we've powered this recliner. Many patients using a recliner are weaker, obviously. So what we've done is we've added a motor to this recliner, and you can see that the movement of the recliner takes the power to push a button.